Namaste. Let us understand rhinosporidiosis. It is a chronic granulomatous disease which is caused by Rhinosporidium seaberry. It affects humans and animals. Humans get affected due to animals, and the medium is contaminated water of the ponds which is frequented by animals. This Rhinosporidium seaberry is a protozoa or a fish parasite which belongs to the drip clade. Let's look at the life cycle of Rhinosporidium. First, we see a trophocyte. A trophocyte has a chitinous wall, clear cytoplasm, and vesicular nucleus with nucleolus. The trophocyte then matures to form a sporangium. The wall of the sporangium consists of chitinous layer and cellulose layer. This sporangium then ruptures to release endospores. Rhinosporidiosis mostly affects the nose and the nasopharynx. Looking at the clinical presentation, this rhinosporidiosis mass can be seen emerging out of the anterior nerves. This mass is leafy and polypoidal. The color ranges from pink to purple. The mass is attached to the nasal septum or the lateral wall. This mass can extend backwards from the nose into the nasopharynx, where it will appear as if it is hanging behind the soft palate. This mass is very vascular, due to which it bleeds on touching. The surface has white dots. These white dots are the sporangia. In the early stage, the patient presents with nasal discharge, which is often blood tinged. Then, nasal stuffiness. Sometimes even frank epistaxis can be the only presentation. For making a diagnosis, we can take a biopsy, where we'll see several sporangia. These sporangia are oval or round, and they are filled with spores. And an important point is that we can't culture Rhinosporidium yet. To understand the treatment, you have to recall again that the mass is producing most of the clinical presentation symptoms, that is, the nasal discharge and stuffiness. Also, it is vascular, so it is producing epistaxis. So what do we have to do? We have to excise this mass. So the treatment is complete excision of this mass with a diathermy knife. And then we cauterize the base. Next, to prevent recurrence, we give dapsone. That's all about rhinosporidiosis. Thank you, and please subscribe for more such videos.